Thank you for your interest in our presentation. The American Indian population has suffered historical trauma that has been a major barrier to access to healthcare. We chose the American Indians for this presentation because there are many tribes across North Carolina, and it is likely we can encounter them in the healthcare setting. Without further ado, I present Culturally Competent Care for the American Indian Population. This is by Mandy Anderson, Brianne George, Iaxa Hunter, Mary Beth Jones, Lisa Turner, and Cody Vestal. First, we'll go over what are the challenges for nurses in caring for the American Indian and their healthcare disparities, perception of health based on cultural beliefs/customs, poor health literacy, mistrust of healthcare organizations, high incidence of chronic disease, infant mortality, and substance use disorders. And this is a map showing tribal communities in North Carolina. We'll go over cultural attributes. The American Indian understands the need for work interwoven with spirituality, balance, and harmonious life. They value wisdom, which comes with age and experience. They do not believe in forcing their beliefs on others. Spirituality is considered part of the person and honors the importance of interpersonal relationships. American Indians feel strong about traditional beliefs because they define who we are. Common beliefs are prayer, revering elders, natural remedies, and medicine wheel or circle of life. The medicine wheel is a diagram divided into 4 sections representing mental, physical, emotional, and spiritual principles. The number 4 is considered sacred in Indian culture. Traditional medicine works from within to the outside, whereas modern medicine works from the outside inward. And next, we're going to go over cultural sensitive care across the lifespan. And this is childbearing women and their families. Childbearing has always been blessed by tribal members and families. It is a positive, encouraging experience for American Indian women to embrace their motherhood, which may be the reason for early childbearing age with American Indian women. A blessing way ceremony is held by female relatives and friends to celebrate and show support for the pregnant woman that will embrace her motherhood. Health disparities with prenatal care for American Indian women are due to reasons such as communication, barriers of physicians, lacks of access to OBGYN services, and other socioeconomic barriers. And this is children age 0 to 17 of age. American Indian children are 3 times more likely to develop ear infections than other ethnicities. 40% of American Indian children are overweight or obese, increased risk of having hearing and or vision problems, greater odds of having asthma. Specific attention should be paid on their respiratory system during physical exams and wellness checks. There's a high prevalence of behavioral concerns with American Indian children, such as difficulty in emotions, problem with concentrating, anxiety and depression, increased odds of having learning disability, and they're more likely to be uninsured. It's harder to receive specialized therapy due to limited abilities. This is adults age 18 to 64. Illnesses is a serious concern to American Indians now facing diabetes, hypertension, and cancer brought by this country by immigrants from Europe. Health disparities exist with limited access to culturally appropriate health care in most American Indian communities. Only 55% of American Indian people rely on federally funded IHS or tribally operated clinics. 1 in 5 American Indians use tobacco. Suicide is the second leading cause of death among American Indians aged 10 to 34. American Indians have the highest percentage of adults diagnosed with mental illness. Prevention and intervention efforts must include supporting and enhancing strengths of the community resources as well as family interventions. And this is older adults, 65 years and over. They have a higher risk for developing diabetes, cancer, and cardiovascular disease, they often mistrust healthcare organizations. Therefore, building trusting relationships with cultural awareness is critical to decreasing disparities. Health literacy is frequently poor. Family plays an essential role in helping them understand complicated medical issues. Nurses should expect a lot of family involvement in care decisions. Preference for traditional spiritual rituals and other healing practices, and therefore nurses need to be sensitive of their cultural needs and allow them that choice. Providing culturally congruent care to older American Indians requires an understanding of their history, beliefs, and customs. Taking part in tribal community activities such as powwows is a fun way for nurses to gain awareness of this culture. Now we're going to go over community health care. The Indian Health Service serves 567 federally recognized tribes of the American Indian and Alaska Native population and their descendants. Their goal is to decrease healthcare disparities that currently exist by increasing access to care, providing preventive services, and addressing specific diseases that affect their people. Target areas include chronic disease management, alcohol and substance abuse, infant mortality, sexually transmitted diseases, domestic abuse, tobacco cessation, obesity, and behavioral health. They also provide a website to educate the public and therefore enhance health literacy. For more information, go to www.ihs.gov. In summary, culture is essential to a person's health and well-being. American Indians want to hold on to their traditional health care practices and beliefs, since so much of their culture has been destroyed, lost, or assimilated into other cultures. The Indian Health Services provides a comprehensive health service delivery system. IHS strives for maximum tribal involvement in meeting the health needs of its population, who live mainly on or near reservations and in rural communities, mostly in the western U.S. The adequacy of funding for the American healthcare delivery system is a factor accounting for lingering health disparities of American Indians. And thank you for your attention, and we look forward to viewing other presentations in the conference.